am Dr. Rakesh Rai. I am Head of Hepatobiliary Surgery and Transplant Services at Fortis Hospital in Mumbai. We are going to celebrate the Liver Day, and it's very important for all of us to realize what's the importance of liver in our body. One thing we need to know that liver is one of the most important organ for survival, and it's the most versatile organ. That means it does so many different kind of activities 24 hours a day in the body, and that's why once you start suffering from any serious liver illness, basically it becomes a life-threatening disease. So it's very important for all of us to take care of our liver. And if we want to take care of our liver, we need to remember three things. The first thing, how to prevent liver disease. Second, how to identify any liver problems if you develop. And third, and one of the most important, that you need to treat it. You need to be treated very properly for your liver ailments. Now, coming to prevention of liver disease, these days with change in our diet pattern and change in our daily activities, a lot of people are developing a disease called NASH, which is non-alcoholic steatohepatitis. Basically, that is accumulation of fat in your liver, which slowly increases, and this fat finally, over the number of years, can cause irreversible damage to your liver. That's one of the preventable diseases of the liver. So you have to be very cautious about your diet, you have to be very cautious about your weight, and you have to be very vigilant of what kind of exercise or no exercise you are carrying out in your daily life. So you have to have a healthy diet, you have to have a regular exercise so you control your weight so that the liver does not accumulate fat. Along with that, there are certain diseases like diabetes which can predispose to fat in the liver. You need to control that diabetes if you have. The other preventable disease in the liver is hepatitis A and hepatitis B. So I will suggest everyone should get vaccinated, because once you are vaccinated, you won't get hepatitis A and hepatitis B. And the third, there are food and waterborne viral hepatitis like hepatitis E, which can be prevented if you take care what you are eating. You should eat your a fresh food. You shouldn't eat and drink in places where hygiene is not being taken care of. Now coming to the second aspect. Unfortunately, if somebody develops liver disease in spite of taking all the precautions, then it's very important that you recognize this liver disease at an early stage before it becomes in advance incurable. And so you need to be aware about what are the important symptoms and signs which tells you that you have got liver disease. First thing is jaundice. Jaundice is yellow discoloration of your skin, yellow discoloration of your eyes. Whenever you have a jaundice, don't take it lightly, go to the expert. Second, if there is any sign of weight loss, if you are having fluid in your legs, if your tummy seems to be distended, then you must see a liver specialist, because these are the signs of liver damage. And finally, coming to the proper treatment. Now, the liver disease and its treatment in itself is a specialized branch. So whenever you have got a liver disease, you need to consult a proper specialist so that he can go into detail, find out exactly what the problem is, and you can have exactly benefit of this developing science, so that almost all the liver disease now can be treated in one form or other.